Oh, good evening, everyone. Welcome and say hello to myself and Pete, Pete Hannan, of course. How you doing, Pete?
I'm all right, Steve. Lovely to see you, mate.
Yeah, you too. Well, Pete and I often get together, and usually it's like dead light-hearted sort of daft waffle. But tonight we're going to have a little bit of a chat in association with our lottery community-funded um, project, which is called "In This Together," and we are in this together because we're going to talk about how everyone was affected by the COVID pandemic, which was what 4 years ago now.
I was going to say, yeah, 5 years ago, 2020, wasn't it? It started in the sort of like February stroke March.
2020, yeah. And
Yeah.
and obviously, it affected an awful lot of people. I was in Spain at the time, so it was slightly different for me and you, but we were both, we both went through it, didn't we? And everyone has different living conditions and living what am I looking for? People. Some people were locked in as families, some people were locked in singly, some people, single parents and stuff like that. Now, from what I can gather, it wasn't quite as strict in the UK as it was in Spain. And I remember I mean, when it first happened over here, in fact, like I remember the whole COVID thing starting, and I remember looking on Facebook and people, because it was called the coronavirus, wasn't it, at
That's
first?
it. Yeah,
And I
yeah.
remember people putting bottles of Corona up and going, "Oh, this is the virus! Like, I'm well up for this." They're gonna,
Mm.
and it was sort of all jokey, wasn't it?
Yeah. Well, basically, what got me thinking about it all, and I'm glad you mentioned sort of like, that it was only sort of like less than, it was 4.5 years ago since it all started, because it's almost like it's been forgotten straight away.
Hang on a minute, we
Um,
got someone coming in. Clive's coming in.
is he in yet?
He's just coming, yeah.
Right. So, shall I wait for him or carry on waffling?
Carry on, and he'll. Oh, yeah, Clive.
How you doing? All right, Craig.
All right,
Hello,
yeah.
Clive.
We just, you know what this is, Clive, I gather.
Yeah, about COVID and whatever.
Yeah,
Yeah.
so we just started talking actually. We
Yeah.
literally just
So,
started. So Pete can just carry on. Carry on, Pete. We're
Oh,
hearing
good.
a bit of Pete's story.
Okay.
yeah. So basically, like we've just finished in this country, our COVID inquiry, and it's cost sort of like £200 million. But it's gone sort of like under the radar a lot. Nobody talks about it much, um, and that's a bit of a concern, really, uh,
Hmm.
because after spending £200 million on on the inquiry, all that's happened at the end of it is they've just said, "Oh well, we'll learn a lesson, and when the next one comes around, we'll lock down sooner." Out of all that £200 million, nothing was ever mentioned about people's how it affected people's mental health. You
Yeah.
know, there's figures that I'm going to go into in a minute anyway. Um, Figures of deaths and this, that, and the other are all out there for people to see. Um, but there's never really been a study on how people were affected, and it's almost like me, like people don't want to admit some of the madness that went on. Uh,
Hmm.
it's almost like suppressing some of it.
I think a
Now,
part of it as well,
I
and what I
I
hope
work.
to, I'm sorry, Pete, what I hope to come out of it as well would be some sort of culpability for a lot of what happened. And because it
Hmm.
wasn't, it's all right saying that the Tory government were in charge of it and they didn't handle it very well or whatever. But a lot of this was down to two individuals as well, wasn't it?
Yeah, well, I'm going to come on to that in a minute
Okay.
as well. The culpability thing of it, but I don't know. It was just the madness of it all. Now, I've come out of it the other end. Okay, yeah, a lot of people didn't come out of it the other end, but I know, as for my personality wise, it's changed me, and I've got two kids who were at school going through it, all the stuff that they've um, missed out on, and everything. But yeah, I am a very much more polarized person, and in my thoughts of things, you're either good or bad. That side of an argument, the other side of the argument. There's no sort of like in between ground now. And it's like with there was COVID deniers. There's how were they called, like the tinfoil hat people, weren't they? Trust me, it was a thing. I work in a hospital. I've seen it all. Um, but then there's the people who didn't want to have the injections, and why you're having the injections for. Um, I just think that the world has changed since we've come out, and not for the
I
not
have
for
to
the.
say though, just to sort of interject when something comes up that I think, I'm going to forget otherwise. The whole like case of having to have injections. I mean, how did you feel about that? And Clive, like the same for you, because I would imagine Clive and you, Pete, had to be properly injected because you both worked as essential workers, didn't you?
Yeah, well, the way I thought about it is, um, to get the politicians, you've got to grasp and trust somebody when something's being said that potentially can cause lots of problems. Now, if a doctor and the health service said COVID is bad, my word, it's bad. If a politician says it, yeah, sometimes you might have to think about it twice. Um, and I do think things went badly wrong because of some characters high up in politics that have been in this country, and then you had Donald Trump in perhaps the most powerful country in the world. Actually, and this is not being made up because I don't like it, perhaps giving people disinfectant or bleach might be the answer of looking after COVID. He actually said that. He actually said that. and 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 obviously, one, we got to know that it was a new kind of virus. We'd never come across it before. So I accept it was difficult for politicians, practitioners, people to get used to, etc., etc. And as Peter said earlier on, you've got this big inquiry. I assure you, in another 20 years' time, when we're gone, there'll be another inquiry, and it will say how wrong people were on purpose, maybe, or something like that. We're having problems years on with what happened at Hillsborough, what's happened with the Birmingham 21. Things will come out in the wash, but sometimes when it's too late, when the people who are involved are no longer with us.
Mm. Pete, what about you?
Well, look,
Just hang
as
on a
you.
sec, Pete. Sorry, Clive.
Yeah?
When we're not speaking, can we turn our mics off because it takes the camera away?
Oh, yeah, sorry,
All
yeah.
right.
No problem.
Right. Yeah. Is that okay then? Yeah. Right. Yes. So, I work in the hospital. In a hospital, I work in the laboratories. I work in uh, I'm stuck away in the basement, not the highest paid person there. Um, and then all of a sudden, you're elevated to this status of a key worker. Now, that word in itself, to me, was totally divisive. It's almost like saying that, oh, someone's important and other people who may have not been able to work aren't important. Some people took it to the extreme. It's almost like the Harry Enfield thing. I'm considerably richer than you. It's like I'm more important than you because I'm a Kiwi. There was people who were furloughed as it was. They were paid to stop at home, but the downside of that is that their businesses that they built up were going tits up. Um, as luck would have it, we locked down in the March there, and the weather was absolutely gorgeous, and it was almost like, oh, this is great. I'm getting paid to stop at home. I I was going into in a position of going into work there, and oh yeah, it was horrible going into work. It was so eerie when all you were seeing at the start of it was sort of like flashing blue lights, the sound of sirens, which was almost like, the death toll really, because people were coming in one door and going out through the mortuary the other side. It was non-stop at first. It was absolutely horrific. But you've got a situation where you've got doctors there who, like patients were coming in, and the whole ethics to me about a doctor and that is that you're there to want to save lives, aren't you? That's what you're there for. But they were bringing this thing in DNR, like do not resuscitate for somebody. So, there's people coming in, if they were, having whatever, rather than make an attempt, it may have been in vain to try and save somebody, but you'll never know. But to actually just have to watch somebody go and not be able to do anything for you must have been, flipping soul destroying for a doctor who's been brought up and gone into a profession to save people. To just
Can I say, Pete? Can I say, Pete? I like it. I worked at a hospital for 11 years in Leicester, and whatever position you were in a hospital, going from a consultant to a hospital porter to a secretary to a pathologist to a supporting pathologist, it was all a new thing, and however much you train to, I always remember one thing happening, and it almost was chaotic. We had, I was at a Leicester Royal Infirmary, and many years ago we had an airplane coming in from Belfast and landed, just missed the runway and landed on the M1.
I remember that, yeah.
Yeah, and wherever you were in the city, I was in an Irish club in Leicester called St Patrick's Club, and it came on television. The first thing I did, as it was asking people to do, as long as you weren't too intoxicated, was to get to the hospital, because they were bringing people in all kinds of situations to deal with. However trained someone is, it's still a first and a new thing for people to experience. And some of these people helping was top of their field, whether they be porters, nurses, doctors, consultants. It's the same I should imagine when COVID, it's where you worked, Pete. It's a new process, it's a new procedure. You might have a piece of paper to talk about these bizarre things that might happen, might not happen, but you always think they're never going to happen. But you've got to take into account people's instinct when it's never been something that's studied in a book or at university or in medical training.
Yeah, I mean, I think the thing with that is as well, Clive, is that you're talking from a medical profession
Yeah,
standpoint, and Pete is, And so then imagine how it feels for someone that knows absolutely nothing about it.
Yeah.
So, you know, you have some sort of background of this sort of thing happens as a procedure, as it would be in hospitals and stuff, you know. But for the just general, you know, man on the street, it was just a completely unknown thing, and it was scary. And I think people felt isolated, you know, and confused. And it's like, but even like in the medical profession, it's like for me, I'm not in the medical profession. I used to work in cardiac rehabilitation in the mid-staff's general hospital. But it's like being trained to do CPR. You know how to do it, but the first time you do it, it's a really, really scary thing that you know, it's that sort of thing, isn't it? It's the unexpected, isn't it? You know, that's what I would think.
Yeah, very, very much so. But I mean, so I'm talking from a sort of like you could call it a privileged position, in that I had a job and I could go out to it in the morning. My actual working pattern wasn't affected so much. I could go out. So I can't really talk for people who were locked into their houses. Now, for a lot of people, they thought this is great. You know, I mean, some people, you know, you had no choice. You had to get along with people you wouldn't normally have been talked to, be that your partner. I bet some people actually, it's the first time they learnt the names of their own kids. No, their own kids' names and everything. But so I can't talk how it affected them. We can only talk about how it affected ourselves individually. But the mass hysteria that got took over with this sort of like this panic buying of toilet roll, they're thinking, well, where did that actually come from? The panic buy to buy toilet roll, you know, what caused that? There wasn't a shortage of it. The shortage was caused by people panic buying.
I should imagine it was somebody who owns a company that makes toilet rolls that maybe said something like
Yeah,
that.
yeah, yeah. You're not far
I
wrong
think
there.
you know you probably said that, Clive. You know, like in well, I don't know. You know, you could be acting as devil's advocate there because I think like a lot of people had the nose in the trough at the time, and although most of us were worried about things, it's pretty obvious when you look back on it with hindsight. There were a lot of people that see it as an opportunity rather than you know, like the position some people were in, instead of being guardians, they were seeing it as personal opportunities to improve their personal wealth, shall we say.
You're saying yes, I love politics, and if you look in politics at the moment, the one lady who's a lady who will be stripped to it any time, her and her husband made up to their age taken off them that, up to £200 million on safety gear for, I forgot her name now, Moan, Lady Moan, huh?
It was Baroness Money.
Yeah, and so, as you just quite rightly said, Steve, there's people out there, however small or little, to make a good living out of this. You know what I mean? I mean, there's always somebody, I'm surprised there's nobody making mugs of Prince Andrew to sat on the streets of what a fucking idiot he is.
See, I think the other thing as well in terms of like money making is you have to look at the pharmaceutical companies, don't you? And I think that's where a lot of suspicion came from surrounding the vaccinations because you know, we're not all as stupid as we look. You know, you might believe that Donald Cummings drove to Scotland to go to, you know, get his eyes tested. Or that's what they think everyone's going to believe. But everyone isn't as stupid as they think they are. So when you look at different pharmaceutical companies bringing out different recipes for inoculations and vaccines, then straight away, you know, you're sort of your mind's taken to drawn to that, isn't it? You know, what are they making out of it? It's just a natural thing. It was
Well,
Exactly. I love my politics, and I'm very left of politics and everything. If there's anything in this world other than the NHS that should be state owned, owned by the state, made by the state, property by the state, is medication, medicines, so everyone can afford it. There's so many medicines held back because we can't afford it, and people suffer because it's not available, because of the amount of money it is. Actually, state owned, given to the people, and it would be a better world for it.
Well, it's quite funny, Clive. You're saying that, but like a lot of the lockdown situation. Do you remember the name Ferguson? He got named Professor Lockdown. Um, Now he broke the rules straight away as well. The rules that he was telling everybody else to do. Now this bloke here, he was responsible. Remember when we'd had the foot and mouth thing, or the mad cow disease, or whatever. So due to his modelling and his idea, let's go and kill 6 million cows. That'll stop it all. He then got involved in there was like bird flu epidemic, and his modelling for that was sort of like, that there were millions and millions of people were gonna die from it. The same with Ebola. Then every single prediction that he'd made with his modelling was worst case scenario times 200. Nothing that this bloke has ever said has been proved to be true. So who do we turn to for our advice? Mr. Ferguson, who's got every fucking prediction wrong. He's the one that we're deciding whether we're going to lock the place down or not. Absolutely. And of course, as soon as it was locked down, he was one of the ones who got flipping caught breaking the rules that they're putting down for everybody else.
I think no, Pete, that wasn't. I mean, that was obviously wasn't just a British thing because every country was locking down. And as I remember it, because I was in Spain, Britain locked down late compared to everyone. I think Spain locked down 2 weeks prior to the UK, and that was apparently the cause of a lot of deaths.
Us going in later. Well, apparently so. Because, like you say, Sweden and Iceland never locked down at all.
Yeah, you got to be careful who orchestrates things, who speaks out, what media people listen to. And I'm sure it went on during COVID, where prominent people in the eyes of the public told lies and fibs, and it was to benefit themselves. Now, just a real brief thing there. There's one thing people can't. If you Google after me now, when people such as oh, this country's full, this country's full, we can't have people in this country, we can't have people in this country. This is a fact, and you can Google this and find the research. There's about over 7 billion people on this planet. Over 7 billion. Do you know every one of them people, every one of them can fish in Texas? Every single one. Every single person on this planet can fish in Texas. So the world is a big place. It's also a thing which you can research and which is a government figure. In this country, in Great Britain, only 14% of the country has got people or buildings on it. The other 83% is just land, countryside, water. So it's how the powerful people portray this thing in things like they own all the literature, they own all the papers.
And the scary thing about those figures actually is that if Elon Musk could give every one of them a quid and still be a billionaire.
Exactly. Yeah. And it's a way he controls the people to keep the people there. I know I came into politics there. I let you that. But one thing I would say on the COVID as well, which hopefully we will touch on, how people were like separated from their families, their friends, etc., etc. Some people still live like that because they've got no family. I know I'm touching into mental health there, but we've got to be careful. Like how we have to be on our own, we can invade people away. Some people live like that all the time, you know.
Yeah, but I think that's well, I do. I live on my own,
And me.
and so, but it was different, and it's odd because we were doing. I think it was on Sunday when we were doing our Sunday talk. We did the 2 hour thing, and or whatever. And on Sunday when I said, because I suffer with some mental health issues, as a lot of people do. During COVID, when I was lecturing at the time, and I could have like up to 30 people on my screen on Zoom, and all having interaction and talking and doing a lecture, but also, it was sort of social as well. And then uh, afterwards, when you sort of turn the lecture off and you finish, you're just in the quiet space. Everything just goes quiet, and you're just sitting on your own again. And I said this to you on Sunday that even, and it will be the same when I turn this one off tonight. It will take me back to COVID because it's exactly that feeling. You turn it off and bang. It's like you, Pete. You got the kids there. You can probably hear the kids in the house or whatever. But when you're on your own, it's totally different. It is. I'm not like crying about it because I wouldn't have it any other way. I enjoy living on my own. But I'm certain that there are a lot of people that, number one, were completely isolated for the first time ever, and number two, still suffer with little flashbacks of it. Just that little bit of me feeling like that for a second or two is post-traumatic stress syndrome, isn't it?
Well, you just saying that. Sorry, Pete. You just saying exactly what you just said there. He's a bit like me. I like my own space. I can cope on my own. Then first 2 seconds when Pete and you say goodbye, you're on your own. Now, 2 hours ago, the consultant who's done all my face, done all that life showed, etc., etc. I've been to see him today with my appointment because you've got to take him back to theatre. He said, I was telling my husband, he said, you know what you're suffering with, Clive? PTSD. Is that what it is? PTSD. Post.
Traumatic stress disorder.
He said, that's what you're going through, Clive. He said, you don't have to be in the army. People think that's something that people in the army suffer with. They do. He said, but all the trauma that you've been through, when you have an hour operation, 30 days of radiotherapy. He said, when you get down and it mixes with your bipolar, you got that distress. He said, that's what you got, exactly what you just said there, Steve.
Yeah, I mean, like you say, with the hospital setting there, it was like all hands to the pump. You had, secretaries were getting stuck in and helping. Even but with us working in the labs, we're hidden away in the basement there. But you'd come home, you'd put the telly on at night, and they'd wheel out the flipping politicians. All of a sudden, you're supposed to be believing people who haven't got a bloody clue what they're talking about, and they're talking as if they're bloody, scientists and that. We used to wheel out this. Well, we used to. The government used to wheel out this bloke called Grant Shapps. Now, I tell you what, Clive, if ever you want to flipping Google somebody, Google this bloke. He's as flipping crooked as they come, mate. You don't remember do you remember the punk band Big Audio Dynamite, Steve?
Yeah, it was ex-Clash members.
That's right. With this Grant chap, his brother was the keyboard player in Big Audio Dynamite. His cousin was a member of the Clash. He's ended up as transport secretary somehow, because he's a stick of shit. He actually got moved from transport secretary to become the home secretary. Okay, you know, absolutely crazy. But anyway, so that they've wheeled this bloke out, and he's saying, "Yeah, we're going to follow the science." I'm sorry, there's no such thing as the science. You've had scientists who are signing up to this Barrington Declaration saying X, Y, and Z, and you had other scientists who were saying other things. There's no such thing as the science, but yet all we had to do was believe what a politician was saying. Now, um, our with the COVID sort of thing in the labs there, it was the only show in town. All we were doing, we had these analyzers and they were running 24/7 sort of thing. Just, just saying, oh yeah, positive, 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 negative, negative. Well, more positives than negatives than that. But there was that many other people with illnesses that you would normally see. Them illnesses weren't going away. All those missed cancer appointments, all those people with UTIs, all those, believe it or not, STIs, like sexually transmitted infections sort of thing. When we come out of the first lockdown, that absolutely went through the roof. They're working at, and you're thinking, oh well, yeah, that's people enjoying their freedom a bit more
Well, it
again.
depends who you're locked in with, doesn't it?
But but yeah, but a lot of them were sort of like STIs that had been laid dormant for flipping 4 months. What were that people were stuck with. The flipping log jams of people. You hear politicians roll out about waiting lists and everything. The impact of locking people down and only being able to, because of the COVID thing, people who had cancers and that. Oh, well, it don't matter. Like, there's only one show in town. It's COVID, isn't it? That whole thing of locking people down, like you say, at first it was an adventure to people. Oh well, yeah, I'm getting paid to stop at home. But who
You see,
wouldn't
like
enjoy?
it isn't, you're talking about that now, and diseases that were pushed to the back. Well, everything was, like you just said, Pete, thousands and thousands of appointments missed, and people not being diagnosed as well, which would have been another thing. So early diagnosis in a lot of illnesses is important. But the other thing as well that they just didn't seem to think about was there's just going to be this huge mental health storm that they didn't even consider. So it's like, hang on a minute, let's just lock these people in a cage for a year and then, but they'll be okay. You wouldn't do it to an animal, would you?
No, absolutely, absolutely not. And this is the part of my argument about, or it's not an argument sort of thing, is that why would you spend £200 million on an inquiry and not even broach the subject of people's mental health?
Exactly. It is so important. One of the other things as well is to do people doing our worship and everything. Now, I totally believe in science. Now, if you got 500 science books and 500 religious books, you threw them all in a big furnace and burnt a lot of them, I guarantee you, in several years' time, all the science books will come back accurate, but not the religious books. So that was crucial when these politicians were all coming out. You had to, certainly in your job, Peter, where you were doing bloods and testing, science is perhaps the most accurate thing that we've got on this planet and should be, listened to so much.
I think the problem with science is though that we've all seen things that were considered to be correct that eventually weren't. I mean, they used to cut the top of your head off to have a look inside if you got a headache. So so even science gets things wrong. And the other thing is, of course, what you can't see. It's like with the vaccines, and I wasn't one of the tin hat brigade, but I wasn't keen on having vaccines, and I had two vaccinations. That's all I ever had, and that was because I had to have them to go to work because I worked in the public sector, with public. So I had to have those. But what you can't tell, and it's like all these things now, like Manjaro and things like this that people are having, you can only see short-term effects of it. You can't see long-term effects until it's long-term, can you?
Yeah, yeah.
So there's been no real. I know they were saying that appropriate testing had been done. The drugs companies said, but they're going to say, aren't they? Because they want to sell it, don't they?
Yeah, like when we came out of that first lockdown, as far as it looked like you mentioned in religion there. Now, to me, I know we've mentioned about like with a doctor's first thing is to want to save a life, and he's been told to slap a DNR on a do not resuscitate on a patient. That goes against the grain there. But then, and I know you may not be religious or whatever, but the House of God churches shut their doors on people. Now we learned a bit more about social distancing as such. Then there was just basic rules well, not rules as such, but basic common sense you could follow. Don't get too close to somebody. Make sure that you wash your hands okay, and just be sensible. But there weren't. No one was trusted in a place like that to be sensible. You weren't. Somebody came out with a thing. You're not allowed to sing. Now we had a garden centre. Garden centres were allowed to open before a church was allowed to open. Now, what sort of a fucking idiot would make a decision like that? Obviously, some atheist. I mean, and I know I've pretty much guessed that you're not a man of God or anything, are you, Steve? But there's a lot of people that were, and in their one time, their one bit of place that they wanted to have a bit of comfort to go to, and
Was the garden centre.
that's it. Yeah,
You know.
seeing
It's just
flowers.
so fucking unbelievable, isn't it? And it doesn't matter. Listen, everyone really has to be an atheist, don't they? Because you can't, no one really knows. So, in terms of religion, I'm not a religious person, but listen, I'd love when I die to be going somewhere else because you have too much fun being here, don't you? But I think, and you hit the nail on the head there, Pete. To open a garden centre, what comfort is that going to give anyone? Spiritual comfort, if you want, as opposed to opening the church doors for people that might be religious.
Yeah, like I say, and that's what you start to question things, then, don't you? Obviously, we when we come out of the first lockdown, there we decided we this great thing, eat out to help out or something. Do you remember coming out of the first lockdown in Spain? What happened there? Because the other thing, which is good for mental health, obviously, is exercise, which is your bag and your game, isn't it? We used to have this bloke on the telly for people who were stuck at home, the Joe Wicks workout, and everybody used to do that. What was the situation with the with your bag, with your industry when you first come out?
Well, I mean, we were one of the last to be allowed to open again because it was open to the public, wasn't it? And it wasn't seen as being something that was essential, which is a bit odd, because obviously any sort of physical exercise releases good endorphins and it makes you feel good and it's healthy as well. Um, it was really difficult because, like I said, you know, we had to have two uh, vaccinations before we could go to work. Then we had a limit, a really ridiculous limit on the amount of people we could have into the gym. It was like you're talking probably in total 30 people, including, you know, 5 people in a class, all had to wear masks. You know, and to have to wear masks when you exercise is really difficult, you know. Uh, yeah. But Spain was a lot stricter than the UK. I was talking to a lady this morning, actually, who was Swedish but was living in Spain at the time. And I know there you could take your dog for a walk, couldn't you?
Yeah. As long as it was just you and the dog, you couldn't sit on a park bench next to anybody.
Yeah. So with us, we had this. You could take the dog out because it was, you know, you had to do it, and you had to be within 100 meters of your home. And the other thing was you had to have your dog's passport in your pocket to prove that you hadn't borrowed the dog
Oh my God.
to get some exercise. The other thing we had to do when we went, obviously, you have to go shopping. And I was stopped. This lady was as well that I was speaking to today. And the police will stop you and then ask you, where are you going? So you say the supermarket. They say, have you got a shopping list? You have to have a shopping list. And they ask you where you live, where you have to prove it. And it has to be the nearest supermarket. Yeah, it was quite. You know, it was scary really in Spain, and like the Guardia Civil, which is the Spanish police, actually is a part of the military. It's not a part of the police, and so like the Guardia Civil, when they tell you to do something or they instruct you to do something, you do it. Like you don't argue, and they were sort of in charge of it. The local police was sort of secondary in it, but it was a very scary thing in Spain. They took it very serious. The Spanish do. They're very sort of listen. Franco's only been gone bloody 75 years, so they're used to that sort of thing. And
Uh,
yeah, and we were very strict with our lockdown. Completely, you know, I've seen videos on YouTube from the UK, and it was nothing like Spain. Let me tell you that.
I'll say something else a little bit later, but we're at school, and the approach to it all seemed a little bit weak. Whether children were more able to cope with these things, the biggest thing we had is when the parents all stood outside next to each other outside the gates. That was a problem. But I always, right throughout the COVID epidemic, I was on duty every day. I opened school every single day. There was 2 meter marks where you could go. School dinners, instead of a school dinner going from 12 to half one, dinners were going from 11 o'clock to 2 o'clock. And so many pupils into the hall and what have you. The cashies was half the children were coming in the morning, the other half, everything was being washed down. Because that was the thing, is whoever you have in is the washing and disinfecting sit down, washing handles, washing chairs, washing tables.
Oh, I wonder how effective that was, you know, because it was like in Spain. I mean, they were just you know, taking shots in the dark. I mean, I remember waiting, queuing to go into the supermarket in the morning, and you all had to stand, I don't know, like 2 meters behind the person
Yeah,
in front, something like that. And I remember that we had to all wear gloves.
yeah.
So there was no mask. We had to wear gloves. And that was every time we go to the supermarket, you have to wear gloves. That was it. And then, like about a month later, you didn't have to wear gloves anymore, but you had to wear a mask. So
Mhm.
it's just like it's almost like you know, listen, that didn't work. Let's try this. You know,
Mhm.
and it was just so obvious that they really didn't know, you know, how to cope with it.
But
No.
the thing is, like some people, they used to have masks as almost like a fashion accessory, didn't they? Other
Mhm.
people wouldn't wear them properly. How many times you would walk in the street and you would just see discarded masks and everything. Now, this is where things start to get a bit crazy. And so apparently somebody has been breathing into a mask all the time. So it's obviously got whatever germs or whatever is there, and it's just been thrown on the floor. What's all that about? Some absolutely crazy. My lad was at there again. It's almost like divide and conquer, is it? As this key worker, I hate that fucking thing. That name though. But my lad was allowed to go to school. There was only about flipping 10 of them in the school because their parents were deemed as this key worker thing. Now, I mean, don't get me wrong. We had our own shopping hour for health service personnel, and it gets me, Clive, you're going on about this 2 metre line. I tell you what, there was no such thing as a 2 metre line. It was more like a flipping rugby scrum when it was the flipping health service happy hour. People picking up flipping God knows what and putting it back down. None of that social distancing from the very people who you'd expect to have a bit of decorum. If they were, if these rules were supposed to be doing anything in the first place. But getting back to these figures, so if you remember when it was all happening, like, we used to have these two blokes, Steve, the Grim Reapers, we used to call them, they'd flanked Boris like flipping security guards. One was called Witty and one was called Valence. You remember
Yeah,
them?
remember. Yeah.
And they were like the Temple of Doom. They were. They get these graphs out and start talking about, all these deaths are going up and this, that, and the other. But in the hospital, by about flipping June, we were privy to different figures, shall we say, than what we were getting shown at 6 o'clock on the night. Completely different figures, shall we say. With the mortality was basically in the 86, the 80 to 86 was pretty high, but getting it down into below 40, it was very, very low. And in the kids thing, next to nothing. But as you said before, all of a sudden, they're saying the age when people need to be injected was going down with no worries. And what was the reason for having this injection? Was it to stop you spreading it? Was it to stop you getting it? No, because people who'd had that injection would still test positive.
Do you think it was like some kind of to make the population feel better, to make it feel as if something was being done? How protective was that vaccination? Was it just like a flu jab? No one really knows about that, and I think that's a little bit worrying, and I think that's what worried a lot of people.
I don't think out of everybody, I don't think the medical profession would be too much of lying about something. I think they went into it thinking that these injections were a business. They were going to do what I said on the tin, and that's the only way forward. Because if you haven't got them, then you got nothing.
Yeah, the thing is though, Clive, that listen, right, doctors don't do the research on drugs.
No.
All right, a medical professional, if you want, a doctor, a surgeon, they have to believe what they're told about the drugs that they use. They don't do the
Mhm.
research themselves. And a lot of doctors use certain companies, as we know. They buy drugs from drug reps.
Yeah,
Drug reps
yeah,
get money dependent on how much they sell to doctors,
yeah.
and the pharmaceutical companies are at the end of it are the fat cats.
Well,
So
as I said to you, sorry to jump in there, sir. As I said to you, all my life fighting politics and being on the left of politics, every single medication in this country, by every country, but certainly in this country, should be state owned, state controlled, where there's no profit, no money to be made underneath the counter,
no,
and
no,
should
no,
be.
I agree with that,
Uh,
totally. But I mean, what we're talking about now is a time, it wasn't like that, was it? So we're
no,
talking
no, no.
about an incident that's happened in the past.
Yeah,
So
yeah,
for
yeah.
me, that whole thing about the vaccinations, there wasn't enough. There couldn't have been enough research in it because it was too
No,
soon. They
yeah,
couldn't have seen what the long-term effect was going to be because it was too soon.
yeah.
They were gambling with something, and I don't know whether they're trying to give people confidence in what they were doing. I just do not know, because the whole thing with that vaccination was just ridiculous. I think it was absolutely ridiculous.
Mhm.
The,
Mm.
the, Steve, like, getting back into the mental health side of things and that, there was so many people who were absolutely scared shitless, not not helped by this witty and Valence thing, flipping, getting their graphs out. That
I'm sorry, just quickly, I think about it. I mean, there's people still are
yeah,
scared of
yeah,
Yeah,
it.
yeah.
A lady came into us today, and she actually was doing personal training. She said, "I don't feel too bad, too great. I think I got a bit of a cold, but I haven't got a mask with me." I said, "Why? What do you want a mask for?" She said, "In case I give my germs to someone." I said, "Listen, if everyone went around with masks on, we would have no immune system."
Mhm.
correct, correct.
So that is just an absolute piss take, to think that. And well, it isn't. I mean, she's just thinking what she thinks. And the other thing that got me at the time was this sort of on Facebook, when it had got things with people's photo fully vaccinated.
Yeah,
You see that, like I've had 3 jabs. It was like a 3 jab colonel compared to, like, a 1 jab lieutenant. It was absolutely, and then of course you got the other people. I ain't been jabbed. I ain't been jabbed at all. It became like, it was almost, it was separating people, wasn't it?
Yeah,
100%, absolutely.
yeah,
And
yeah.
that's the one thing I've took into my post-COVID mentality state now. I'm very polarized in the way that I actually think about things these days. Um,
I think Pete, and Clive, uh, what I want to do with this is I want to carry this on to a second discussion,
Yeah.
because I don't think we've gone. Listen, we're just scraping the sides of it at the moment, and I think we've been an hour. And what I
okay,
think we should do is we're going to air this in the group, and then the second part of the discussion, which we can decide when we're going to do it between the three of us, if you want.
Yeah.
But we can invite people onto it, because I think this is going to it's going to stir a lot of people's memories and opinions and thoughts. And I think if we try and rush this, because this could easily be a 2.5 hour discussion, and I think
Oh, yeah.
and we don't want to rush it and close it
Hmm.
no,
before we've discussed it properly. So what I suggest we do is, probably leave it there for tonight,
Yeah.
and then we'll decide when we're going to do it again, when it suits the three of us. We'll put it out there, and we'll invite people to take part if you agree with me.
Yeah, totally, totally,
yeah,
totally. Yeah.
I totally agree, Steve. Because, like you say, I haven't scratched the surface. There's so much that I
Yeah.
wanted to talk about, and especially with the mental health side of our kids
Well, we
and everything.
haven't touched on that, and really, the mental health thing is a big part for us. But you know, it's also interesting, I think, to get other people involved. So I know there's three of us here, and we're all different. But if we could get another four or five people that wanted to get involved in the discussion, I think it would just open it up a little bit and
Yeah,
and get more interest. And it
it-
doesn't want to be. I know, Clive, you know, we all have our own political beliefs.
yeah,
And I think it isn't political. What we're looking at here is we're looking at the human side of it.
yeah, because the more people involved, because what we got to think about, you're quite right, is I forget the point. COVID is still affecting people. It's still affecting people. Funny enough, you just saying that. I haven't heard the news today. My head teacher's been to the house where I live on site, and she said she's had 3 teachers off in the last 2 weeks with COVID. So it's still there. It hasn't gone away. Okay, the extreme um, of it is possible where you got like 100 people in the area. So it's still there and it's still affecting people. And people haven't come out the other end yet, you know. They're still scared and still
Yeah,
worried.
and I wonder, you know, if
Yeah,
actually the long-term effects of it, in
exactly.
terms of mental effect and the way it's affected families and the way we
Yeah,
live, is a lot worse than if we just completely ignored it.
exactly, exactly.
Well, one last thing before we end there, that now that you've just quickly mentioned that, Clive, is that you know, like when if you test positive for COVID, you had to isolate for 10 days. Then they did it 5 days. You know, if you turn around and you've tested positive for COVID, you don't have to isolate. You're expected to go back into work if you're feeling okay. You know,
Well,
Yeah.
fucking
I don't know. Funny enough, I'm going to tell you something now. I was going to tell you at the end. I haven't been, because of my operation and different things like that, I haven't been to work for over 12 months. So, Peter, I couldn't tell you the policy of what this school does. So I don't know. The other thing is I wanted to tell you, nothing to do with this, as of, well, I knew last week, I'm retiring early. I'm retiring at the end of the year. On the 31st of December, Clive Murphy is retired from work.
bless you.
I,
That's another thing we can talk about with another topic. At you know what to do with you know how people cope with retirements and
you're right there.
But this, you know, this actual topic of COVID is an absolutely huge thing, and I don't think,
Oh,
you know,
yeah.
Pete, when you suggested that we talk about it, I thought, yeah,
Yeah,
brilliant. But
yeah,
you don't
yeah.
actually realise how big it is until you actually start talking and then
Mhm.
realise that, you know what, like I said, we haven't even scratched the surface of this, you know, we
Yeah.
haven't. So what I'd like to do is, Pete, firstly, because you were like, it was your idea to do this, a great idea, and thank you for that, Pete. And Clive, we didn't know you were coming on. You came on, and I'm glad you did because it gives us that third person, which I think makes it a lot more interesting, you know.
Oh, yeah. Yeah.
So what I'll do, will liaise with you both, and we'll have a part two. So when I put this out later this evening, it's going to be on in the group and in YouTube. This will be part one. Okay.
Okay, that's lovely. Yeah. Look forward to the next part too,
Yeah.
Peter. And
So guys, thank you very much, and
okay,
you know,
take care.
let's take it up uh,
Yeah,
next time and see exactly where we go with it. Thank you.
brilliant.
okay. Good night,
Cheers.
Peter. Good night, Steve.